Hello everyone, I'm Dr. Sistare with Palm Beach Cosmetic Surgery. Thank you again for watching another one of my videos. Today we're going to talk a little bit about fat transfer and specifically a procedure called a Brazilian butt lift, otherwise known as a BBL. So I previously discussed liposuction in a different video. Sometimes when you remove fat from one area of the body, you don't necessarily need to get rid of that fat. You can replace the fat in other areas of the body to achieve particular results. Sometimes the fat is replaced into the face, and the stem cells that exist in the fat do a good job of revitalizing the skin in the face. Other times, you take the fat and you replace it into specific areas of the body with the goal of achieving volume in that area. So, which brings me to my next point, a BBL. So, a BBL is a very particular procedure because it's actually a combination of two different procedures. It's a combination of liposuction followed by transfer of the fat that you remove into the butt, on top of the muscle underneath the skin in the butt. And the goal of this fat transfer is to give you a bigger butt, a more youthful butt. It smooths out the skin, makes it rounder, and elevates it a little bit as well. So there's a few things that you have to consider when transferring fat from one area of the body to the other. So when you remove fat, you remove that fat's blood supply. It's now existing as its own little entity. So when you replace that fat, in order for that fat to survive in its new location, your body needs to give it a new blood supply. Inevitably, when you transfer fat from one area to the other, the fat that you replace, not 100% of it gets to establish a new blood supply in time before it gets reabsorbed. Normally it's about 50 to 70% of it remains, but that means somewhere between 50 and 30% of it gets reabsorbed. So that whole process takes about 6 weeks. So after you've transferred fat to your butt, one of the normal pieces of advice during the recovery process is to not sit on your butt for 6 whole weeks, which is pretty inconvenient, but if you're looking to maximize the results from your BBL, that's something that you need to abide by. Otherwise, it can contribute to asymmetry or lumpiness, or what you want to avoid most is it can actually diminish the amount of fat that survives in its new location in your butt. So you've probably heard about the BBL in the media because it's unique compared to a lot of the procedures that we do because it's considered a high-risk procedure. And the reason for this is there exists some very large vessels that transfer blood around the area of the butt, in the muscle of the butt. If, in the process of transferring the fat, the tip of your cannula, the instrument that you're using to replace the fat in the butt, if it enters the butt muscle, there's a higher chance that that fat will enter the bloodstream through one of the vessels in your butt, make its way back to your lungs, and give you issues breathing. And it can be very dangerous if you're sitting at home after your procedure and all of a sudden you don't have anybody to help you. So we take a few precautions to make sure that this is as safe a procedure as possible. One of the ways of making sure that this is safe is we do this with an ultrasound device next to us, which allows us to see specifically the layer of tissue that we're placing the fat in. We can make sure that the tip of our cannula doesn't enter your muscle, because ideally you want the fat right on top of the muscle, but not inside the muscle. So there's a window for the perfect area that it's supposed to be. Additionally, the chances of you having any complications decreases with the amount of fat that you transfer. So the less fat you transfer, the less likely you are to have a complication from the fat that you transferred. So you play this game where you want to give the patient as much volume as possible, but you don't want to put so much volume in that you're starting to increase the chance of a complication from the procedure. So it's important to pursue a surgeon that's done this before, that has the appropriate training and takes the appropriate precautions to make sure that not only you're getting the result that you're looking for, but also you're doing it in as safe of a manner as possible. One of the things that you need to consider before undergoing a BBL specifically is, do I have enough fat elsewhere to transfer to my butt? So if you're a naturally skinny or petite person to begin with, I've run into the situation a few times where a woman comes in asking for transfer to the butt, but they just don't have enough fat. There's other options for gluteal augmentation aside from the Brazilian butt lift. There's two major types. One is a silicone implant in the butt, which does a really good job of giving you volume and lifting the butt. However, it doesn't feel natural. The silicone that we implant is kind of hard compared to normal tissues. But it gives a great look, especially on people who don't have enough fat to transfer. The third option, and it's my personal favorite, is something called an auto-augmentation, where instead of removing the fat with a cannula and replacing it into the butt, what we do is we create a flap, a tongue of tissue from your lower back, and then we swing it down into position to sit right on top of your butt muscle. So there's some advantages to this procedure. There is no reabsorption of the fat because we don't alter the blood supply to the fat, and the results are permanent and very predictable. There's no reabsorption. So what you see after surgery is what you're left with months to years after surgery. Whether the new fat in your butt is placed through an auto-augmentation or placed through a fat transfer technique, it's subject to the same changes that fat anywhere else in your body would undergo. If you lose weight, you will lose weight from your butt as well as the rest of your body. If you gain weight, you'll tend to put on weight anywhere you would have tended to put on weight had you not had a repositioning of the fat in your butt. So you got to keep that in mind. One of the things that we look for in a patient before undergoing these procedures is the fact that they've maintained a stable weight for a period of time and they're not planning on losing any more weight after the procedure, because it could affect the results that you've just achieved. So that's a BBL and fat transfer in a nutshell. If you have any more questions for me, I invite you to come talk to me. Consults are free. I'd really love to get to know you personally and figure out exactly which of those techniques I mentioned is best for you. Once again, I'm Dr. Sistare with Palm Beach Cosmetic Surgery. Thank you so much for watching, and we'll see you next time.